and distress for the child and especially for the parents. It does not directly address or treat the ear infection itself, giving parents the opportunity to make decisions aligned with their own therapeutic values rather than having medical preferences imposed on them without clarity. Why are alternative practices popular for ear infections? You've probably heard that taking a child with an ear infection to a therapist, whether an osteopath, chiropractor, naturopath, acupuncturist, or others, could help relieve their pain. Perhaps friends or family have even told you that it worked for them. Give me a second, I'm arriving at my clinic. We'll explore why this narrative should be approached with caution, even if anecdotes abound, and of course, what science has to say about it. 1.5 billion people worldwide live with chronic pain. So if you enjoy my content, subscribe. It takes just 1 second. But most importantly, leave me a comment to let me know you've subscribed and share this video on social media. You can even create short videos from it. Help spread the message to reach and support as many people as possible. Finally, every month I offer a free consultation to one person via video call or directly at my clinic. Let me help you better understand your neuromusculoskeletal pain and provide you with personalized tools to manage it at home. To participate, subscribe to my YouTube channel and leave a comment under the video mentioning that you subscribed and describing the issue you'd like to discuss. To double your chances, visit cliniquepsb.com, go to the health articles section, sign up for my clinic's health newsletter, and choose an article to leave a comment with your YouTube username. Good luck to all. It's important to understand that ear infections are a common condition among children, babies, newborns, and toddlers. They are often a source of pain and distress for the child and especially for the parents. An ear infection, or otitis, occurs when the middle ear becomes inflamed, often due to a buildup of fluid behind the eardrum. This inflammation is typically caused by bacteria or viruses, and it's especially common in babies and young children under the age of 3. Babies are more susceptible to ear infections because their immune systems are still developing, and the eustachian tubes in their ears, which help drain fluid, are shorter and more horizontal, making it easier for fluid to accumulate. Acute otitis media is the most frequent type of ear infection in young children. It involves a rapid onset of inflammation and infection in the middle ear, often accompanied by pain, fever, and irritability. Babies may pull at their ears or cry more than usual. Therefore, when conventional treatments take time to work or seem to fail to provide a long-term solution with symptoms recurring, many parents turn to so-called alternative solutions to ease their child's discomfort. Some parents may also be influenced by positive testimonials from others around them, which can create the impression that these practices are truly effective for ear infections. However, such testimonials are not always indicative of real effectiveness, and it's important to understand why. Do you know the concept of spontaneous remission? In many cases, ear infections naturally resolve on their own within a few weeks, even without any intervention. As a result, it may appear that an alternative treatment was effective, when in reality, the infection simply followed its natural course. Also, consider this. By the time parents turn to so-called alternative treatments, a significant amount of time has often passed, marked by dissatisfaction or lack of success with conventional medical treatments. As a result, the condition has likely progressed closer to its natural resolution. At this point, seeking help from a pseudo-health practitioner offering alternative therapies often coincides with the improvement of symptoms. However, this improvement is not necessarily due to the therapy itself. Had you waited a few more weeks, the same results might have occurred naturally without spending unnecessary money on a treatment that provided no concrete benefits apart from a potential placebo effect. Additionally, it's important to understand that factors such as human contact and comfort can play a significant role in easing stress related to a health condition. For instance, a therapist who spends considerable time with your child, often more than a doctor does when diagnosing an ear infection, and offers attentive listening, creates a soothing and reassuring atmosphere. This environment can enhance the placebo effect, providing perceived benefits. However, it does not directly address or treat the ear infection itself. For those who follow my channel, you know we love to explore what science has to say. Many studies have examined the effects of alternative treatments on ear infections. Overall, the research shows that none of these practices have demonstrated direct effectiveness in treating the infection or significantly reducing its symptoms. Medical institutions generally recommend managing ear infections with measures such as pain relief, monitoring the infection's progression, and, in some cases, antibiotics. It's also important to remember that pseudo-health recommendations are not limited to alternative therapists. Even medical doctors can practice pseudoscience, sometimes simply to reassure patients. A common example is prescribing antibiotics without clinical certainty that the cause of the ear infection, referred to in this case as otitis, is bacterial and not viral. Some medical doctors may feel uncomfortable not providing a concrete solution, even if the treatment is inappropriate and unlikely to improve symptoms. This highlights the importance of ensuring patients, whether they are seeing a doctor or a therapist, receive proper informed consent. Patients should always be encouraged to ask, are there alternative options, and what are the risks associated with this treatment you're recommending? For instance, if a medical doctor says, I'm not entirely sure if this otitis is bacterial or viral, therefore antibiotics may not be effective. Current guidelines suggest waiting a few more weeks before considering further intervention to determine the nature of the otitis. Based on my clinical evaluation, I don't have a clear answer, so you have a choice. You can wait, or we can proceed with antibiotics. In the best case scenario, the antibiotics help. In the worst case, they might slightly impact negatively your child's digestive system. What is your decision? This type of transparent conversation is key to informed consent, giving parents the opportunity to make decisions aligned with their own therapeutic values rather than having medical preferences imposed on them without clarity. In the same spirit of clarity in our health decisions, it's crucial to stop perpetuating the myth that alternative treatments can help with ear infections. Not only does this often lead to unnecessary expenses for parents, but it's also common for these treatments to be stretched out over prolonged sessions. Managing infections is the role of medicine, not that of a therapist. If your child has muscle tension in the neck or behind the ears, it's perfectly fine to consult a therapist for those issues. However, let's dispel the myth that neck manipulations or treatments around the ears by a therapist are the key to relieving ear infections in children. It's time to separate fact from fiction and approach these conditions responsibly. And that's why it's now your responsibility to take a moment to subscribe and click the little bell so you're notified about all our future videos. Here is the worst chiropractor in the United States with a 1-star Google review treating a patient. The link should be popping up right now. In the meantime, share your story, comments, suggestions, or let me know if you still have any questions. Because with knowledge, you build your autonomy, navigating your health with more certainty.